Male factor infertility can cause a lot of resentment, and this is one of those topics which no one talks about. And if you want to find out more, please watch this video right till the end. I'm Dr. Malpani, I'm an IVF specialist. And because I've been treating infertile couples now for over 30 years, one of the things we've realized is that both men and women look upon infertility in IVF very differently. And this can be a huge problem, and the reason for the infertility is what we call male factor infertility, when it is the husband or the man who has a fertility problem. For example, his sperm count could be 0, or he could have a very low sperm count. Now, logically, obviously, the expectation is that if it's the man who has a problem, it's the man who should take the treatment. After all, if it's his problem, he doesn't have enough sperms, or his sperms are too weak or whatever, then the doctor should treat him either with a medicine or an injection or an operation or whatever else have you, get his sperm count up to speed, and then he can get his wife pregnant in the bedroom. Very logical. Unfortunately, life's not always so fair. And ironically, we really don't have very good medicines or treatment options for the infertile man. Or let me rephrase that. We have hundreds of medicines, and the reason we have so many is because nothing works. Now remember, if something works, then one medicine is enough. Thus, if you get malaria, you go to any doctor, everyone's going to write the same prescription because everyone knows that medicine works. But when nothing works, there are 100 medicines because no patient wants to hear the truth and no doctor wants to tell you the truth. Oh, you took Zevit, didn't work? Let's try Evion. Oh, you took Manix, didn't work? Let's try Fertilem. Oh, that didn't work? Let's do varicocele surgery. 50 different things, all of which are completely ineffective and don't work at all. But the poor patient is desperate, eternally optimistic, very hopeful. Fine, this new doctor whom I've read so much about on the internet will definitely fix my problem. Or this fellow helped my bhabhi's husband to fix his problem, so I'm sure he can help my husband to all kinds of things. The reality is, these things just don't work. And ironically, there's very little we can do to treat the infertile man, because the entire science of andrology itself is still very primitive. But ironically, there's a lot we can do to treat the woman. Women have always been ahead, I know that. But what we can't do for the man, we can do for the woman in spades, which means we can actually compensate for the man's infertility by improving the fertility for the wife. How does this work? Doesn't sound very intuitive. But it does, because that's exactly what IVF does. It's called IVF-ICSI, and what that means is that what a man's sperm cannot do in the bedroom because the sperm count is too low, or the sperms are not motile enough, or all the sperms are dead, or whatever it may be, we can actually do in the IVF laboratory using a special machine called a micromanipulator, and the procedure is called ICSI or ICSI, which is intracytoplasmic sperm injection, which means under a microscope we take out the wife's eggs and inject a single sperm inside the egg to fertilize it. This works whether the man's sperm count is 0.001 million, or even if it's 0, because we can actually extract the sperm from the testis, and we're giving the sperm a piggyback ride into the egg to be able to fertilize the egg. So it really is a little bit of magic. And men are happy. Oh, great. I have a problem. You're solving the problem. That's all we want. At the end of the day, I just want a baby with my sperm. And it doesn't really matter whether I do it in the bedroom or you do it in the lab. We'll have a baby. That's great, doctor. When do we sign up for this IVF treatment of yours? It's the woman who's not very happy about it, because in an IVF cycle, she's the one who has to go to the clinic. She's the one who has to have the vaginal ultrasound scans. She's the one who has to take all those injections. Not much fun, is it? And that's why she resents it. She says, it's not even my problem. I'm absolutely fine. I'm fertile. I could have had 50 babies in my bedroom if I'd married someone else. My eggs are okay. My tubes are okay. Everything else fine. But because my husband has a low sperm count, I'm being made to take all these injections and go through all these scans and blood tests and what have you to compensate for my husband's poor sperm count. Is that fair? And that's why they resent it. And the resentment mounts even more when the husband refuses to be supportive, refuses to go to the IVF visits with his wife. His whole approach is, okay, he wanted a baby. Now, it's not happening in the bedroom. I know I have a low sperm count. I'm really sorry, but I can't do anything about it. It's not my fault. But we should be looking for problems. We should be looking for solutions. This doctor has given us a solution. And it requires you. So I'll come on the day and give a sperm sample. What else do you want from me? Why isn't that good enough? Aren't I paying the money for your IVF treatment? Shouldn't that be enough? And the poor wife doesn't really have a choice because she wants the baby. She knows she doesn't want to rock the boat. She doesn't want to upset her husband, but she resents this, trust me. And this can often cause long-term problems. So, just a piece of advice. Remember that infertility is never just the husband's problem or the wife's problem. It's always a couple's problem. Both of them have a problem, which means both of them are required to have a baby. And if they're not having a baby, it's a problem which needs to be addressed as a couple. And it doesn't matter whether the problem is the husband's or the man's or whatever. IVF treatment is actually always done as a couple, as a unit. And you need to be able to love and support each other. It's difficult times, no question about it. But if you can love and support each other during this difficult time, trust me, your marriage will be much stronger than an ordinary marriage. And you will be much happier and much better parents because you've been through this trial by fire. And if you have questions, please feel free to ask me, but don't bottle up your resentment or don't let it burst out and don't take it out on your husband, please. I'm Dr. Malpani, happy to offer a free second opinion to help you to have a baby. Our website is www.drmalpani.com. I'll see you online and more than happy to help you so that you can have a baby which you're looking forward to. Thanks and take care.